There's been a big report about how we look after our teeth. It found that too many Aussies have bad teeth, especially people living in poor areas. And about a third of us don't go to the dentist because of the cost. So what can be done about the problem? Sarah looks into it.
Don't be scared. Show me your teeth.
How good are teeth? You show them off when you're happy or angry. Use them to eat and sing. And we all know that looking after teeth is really important. That's why we do all that brushing and flossing and gargling. But sometimes you need a professional to help you take care of your chompers. Dentists know their teeth. They train for years to do what they do. But that expertise comes at a price.
Thank you. A trip to the dentist can cost a lot of money. And that means some people are missing out on the care that they need.
According to a report which came out last week, about a third of Aussies don't go to the dentist, either because they can't afford it or because getting to see one is too hard. And that means millions of teeth are suffering. It's not a new problem. In the old days, dental work was often reserved for the well-off. Young people would sometimes have teeth removed because it was cheaper than fixing problems. And being old usually meant being toothless. Over the years, there's been some work done on improving Aussie teeth, like education, teaching kids about how to care for their mouths. The state government set up places like this, school dentists where kids could get treated for free or for a small fee. Older kids can also get vouchers which let them go to the dentist for free. And pensioners and people who don't earn much can go to special public dentists for free. But according to last week's report, these are all just fillings. There's still some nasty decay in the dental health system. What some are calling for is a system a bit like what goes on here in hospitals and doctors' surgeries. Every Australian has access to cheaper medical care thanks to a system called Medicare. The idea is pretty simple, really. Everyone pays tax based on what they earn. The government uses some of that to pay for doctors and nurses and hospitals and high-tech gadgets to treat people. So, in theory, no one misses out on getting the medical care they need. Except Medicare doesn't cover dental, and some say it should.
We need to work towards a universal dental care so that going to the dentist is just like going to the doctor.
This guy's a politician in the Greens Party, and they've been asking the government to spend more money on dental care for a while now. And they're pretty happy because last week's report backed them up. Except the report also said a dental system like Medicare would probably cost more than the government could spend. So it recommended focusing on the most important issues first. That's you guys.
Focusing on children is focusing on the future. If we can solve children's dental health, that's what's going to hold us in good stead for when we become adults.
They want to make sure every kid can get to a dentist for free, and they want to help people who can't afford dental care. It's still going to cost a lot of money. The report said about $10 billion over 4 years. And with the government determined to save money this year, we'll have to wait and see if anything changes. But hopefully this is one issue that won't be brushed away.